I have the client push the cart unless they need assistance. So the biggest thing we want to do here is create just like a space of autonomy. We want folks to be able to grab the things that they want, be able to navigate it like they're going to a regular grocery store. It's really important. I grew up going to a lot of food pantries where you just go to like a dark corner in a basement somewhere and they give you a box and then they ask you to join their religion, and we don't want to do that here. What I like to do is just explain what we have and encourage folks to choose what they want. So today we have apricots, green beans, peas, corn, and spinach. They'll grab what they need. We're really lucky to have a lot of variety right now. We've made some strategic decisions to get us some more things, so we're constantly having like good choices to choose from.
PEP gave me peace of mind. It really did. I knew that if I followed the instructions on the bottle, I would not contract HIV.
PEP is used for the prevention of HIV, and it stands for post-exposure prophylaxis, and is used in patients who think they have been exposed to HIV.
I met someone, we dated for a couple months. I found out about like 30 days into us dating that he had been using intravenous drugs at a party and wasn't sure if he had shared needles or not. I think anybody who believes that they've been exposed or might be at risk of an exposure to HIV should reach out and immediately get PEP. It's important to take it really close to your exposure.
We would like for the patient to take it within the first 72 hours, so as soon as possible, and you usually take the medication for 30 days. We are the only pharmacy in the greater Rochester area that offers PEP 24/7. You can call us anytime during the day, even after hours, and we can always deliver this medication out to you.
So I think it's important to keep PEP in mind as an option, because a lot of the time you don't know if someone has HIV, and there are people who don't know they have HIV yet who are still able to pass on the virus. So for me, it was important to kind of listen to my gut and be like, it was a risky situation I was in, and I need to address that and take care of my health.
It's important for people to know that there are medications out there to prevent HIV, and it also gives you a peace of mind.
And I'm really glad that Trillium exists to help people get PEP and to help them take care of themselves after an exposure. I think it's an important service, and we're really lucky in Rochester to have Trillium.
Good morning. I want to take a moment to thank our partners here today. First of all, Jason Barnett-Kearns, who is the President and CEO of Trillium Health and a wonderful partner, a dear friend. I'm grateful to him for hosting us today and for his willingness to speak out. Just a few weeks ago, congressional Republicans passed the most harmful piece of legislation to come before Congress in generations. Donald Trump is kicking more than 15 million people off their health insurance to give tax breaks to his billionaire friends. This is a betrayal of working people in Rochester and around the country. But the consequences, which honestly I don't think the president even cares about, he expects the people of Rochester to pay for the price for his corruption. And I'm not going to, nor are many other members of Congress going to let it stand. The bill, just as a reminder, cuts $900 billion in Medicaid funding, the largest cut in American history. You deserve better. You deserve to have a system that's fighting for you, not a system that's fighting against you. And with that, I want to turn it over to a wonderful partner, a dear friend, and someone who leads this organization with great distinction, Jason Barnett-Kearns, President and CEO of Trillium Health.
Trillium Health is a community health center dedicated to providing compassionate, judgment-free, and affordable care to everyone in the greater Rochester community. On July 4th, President Trump signed H.R. 1 into law, a sweeping bill that drastically alters Medicaid and threatens how millions of Americans access health care. The federal changes will have a direct impact on community health centers across the country. At Trillium Health, 40% of our patients, about 5,600 individuals, are covered by Medicaid. We anticipate that many of our patients will lose their health insurance due to Medicaid work requirements or becoming ineligible for the essential plan, resulting in an estimated 1 million loss in annual revenue.
Thank you, Jason. Now let me ask Rory Dumas, who's both a patient and an advocate, to share his story.
Several years ago, I had a job that closed down, and I needed health care, and I qualified for Medicaid, which I was very grateful for at the time. I've been a patient at Trillium for a lot of years, and it's been exemplary care here, always. Medicaid actually helps me maintain. As I get older, things are starting to fall apart, and I've been able to get the best care I can get because of Medicaid and Trillium Health. It doesn't make sense to me that people potentially are going to get sick and die because the government wants to play games with people.
It is not only un-American, it's immoral. Thank you all. Thank you again, Jason, for the extraordinary work that Trillium does day in and day out. Rory, thanks for sharing your story. We'll continue to keep you in our thoughts, and thank you all. God bless.
Today we're installing a harm reduction vending machine courtesy of New York Matters. So it's going to have naloxone, fentanyl and xylazine test strips, as well as other kinds of harm reduction supplies. It's all totally free and accessible to anyone in the community who wants them. So the vending machine is located at 259 Monroe Avenue. It's in the parking lot just outside of the clinic doors. When folks have better access to things, especially 24/7, right? We don't have to be open in order for them to meet their needs and in order for them to have the help that they need, including help from things like naloxone, which is a drug that can reverse opioid overdoses and save lives. So we do a lot of harm reduction work at Trillium Health, specifically at our harm reduction services site at 39 Delavan Street. So we provide a syringe service program, an opioid overdose prevention program. We help people get connected to treatment. We do testing for HIV, Hep C, and STIs. Anything that somebody might need, we help provide it to them safely, effectively, and at low or no cost. So Trillium Health and Trillium Health Harm Reduction Services is a safe place for people who use drugs. It's a judgment-free zone. Anyone of any race, ethnicity, creed, sexual orientation, or gender orientation can come visit us. Anyone who uses any substance for any reason can visit us and learn more about how to do so safely.